How's it going, guys? We're going to be placing an NG tube today. We're going to start by knocking. How's it going? My name is Nick. I'm going to be your nurse today. Can I get your name and date of birth, please? Do you have any allergies? Perfect. Today we're going to be placing an NG tube in you. We're going to be putting a tube down your nose into your stomach to feed you. I would begin by placing the towel over them. Also take a look at their nose. Okay. I'm gonna provide privacy. They're also already in the position that they need to be in prior, so perfect. And now I'm going to put gloves on. Okay. I'm gonna take this out. We're gonna measure it. This is not sterile, so you just do our thing with it. Now I'm gonna measure it. I'm putting it to their nose, to their ear, and then we're gonna cut down to their stomach. So about 55, we would mark that. And now I also have a cup of water that I would give to them to drink while I'm inserting the tube. So now we're going to begin inserting the tube. And I would reassure them that gagging will occur, but I'm going to help them do that. And I'm going to insert the tube and have them look down and then drink sips of water. And our precaution for communication, he's gonna throw his arm up. Let's begin. Alrighty. So I'm gonna insert the tube. Hold their head back. Some good, holdingness. And I'm gonna help them through this. So we're gonna do this together. I'm gonna insert the tube. And then we're going to go down. Wow. And we're going to go down to the marked area. And now I'm going to have their chin down. They were sipping water through this process too as well. And now we're going to go to the marked area. This is definitely 55 for sure. Perfect. Now we're going to tape it together so it's secured. And we're going to also, I would use a CO2 detector to make sure it's not in their lungs. I'm also going to do a little listen just to make sure everything sounds good for their respiratory system. Okay, take a deep breath, deep breath, deep breath. Deep breath, deep breath, deep breath. Perfect. Okay. They're also going to be getting an x-ray today, just to make sure it's in the right placement. And then I would connect this to their gown, just to make sure it's secured. Has the tape on as well, so it's in good secured. And then I would remove my gloves, and I would do oral care. Which I just did. Already did oral care. We'll skip that part. And then I'm going to make sure he is in a good position, and we're going to feed him here in a little bit. So we're gonna pause there. Okay, now I'm resuming. I would first start off with hand hygiene. I would wash my hands, then I would apply gloves. The patient is already in the correct position for feeding. Also, I had two methods to confirm it's in the right place using CO2 detector, and the x-ray was already given. And now I would get 30 to 50 mLs of water. I would get 30 to 50 mLs of water. I would remove the cap, and I would flush this and put in 30 to 50 mLs. Slowly. Okay. Now I'm going to take the top off. And I would use the feeding if I had the can with me. I would disinfect the top of it, and I would pour it into the top part. So I would put the cap on the top of this. I remove the plunger. Now I'm going to pour it in the top. I would pour it in the top, and then I would remove the tubing. And then I would also reflush again, the same amount we just did, 30 to 50. Reflush. And now I would clamp the tubing over the end cap. And then I would remove my gloves, perform hand hygiene, keep the patient up for 30 minutes after feeding. Make sure they're leaning to the right. And then I would keep them in a safe position, provide privacy, and then give them their call light, and we'll be back to remove the feeding tube. I would knock, re-enter the room. I would restart in. I would say, "Hi, my name's Dick. I'm gonna be your nurse today. Can I get your name and date of birth?" Okay, today we're gonna be removing your nasogastric feeding tube. How it's gonna work is I'm gonna just be taking it out of your nose, out of your stomach. I would ask, do you have any allergies? And then I would keep this at 30 to 45 degrees. It's already at 45, so it's perfect. Then I would re-put the towel back on, a new towel. And then I would give them this emesis basin, just in case, have it for them in their hand. And then I would do hand washing, and I would put new gloves on. Quick hand hygiene. Okay. Okay, then I would detach it from their gown. I would detach it from their gown. I'll put that back. Take the tape off both sides. And then I'm going to remove the tube. And when I remove the tube, I'm going to ask the patient to take a deep breath while I'm removing the tube. And I'm going to explain that's going to be very uncomfortable, but we're going to go through this. So then I would grab the tube. So I'm going to be removing the tube now. Please take a deep breath. And then take a deep breath, and I'll just start pulling it out safely and securely. Make sure my hands are nice and firm. Okay, it's out. And then I would inspect it, make sure there's nothing missing from it inside. And then I would remove the tube, and then I would dispose of it in proper place. Okay, and then I would record any output, dispose of anything I need to do. Then I would remove my gloves after I dispose of everything. And then I would also wipe their nose with a paper towel or Kleenex or anything like that. Then I'll remove everything. And then I would have them, I would lay them back, make sure they're in a safe position. I would perform hand hygiene before I left, and then I would document everything. And that would be it. Thanks for watching.